Gingy has been experiencing sensitivity to her teeth and noticeable white spot lesions, especially near the gum line. This is her first dental visit in about 2 years. Her mom, Mrs. Composite, was unaware that baby teeth needed just as much, if not more, care than permanent teeth do. Mom wants to do better with the oral care of both of her children and pass these new changes along to her new baby.
Hi, Miss Composites. Hi, Gingy.
Hi.
Welcome back. It's been about 2 years since we guys seen you last, so we're happy that you're able to make it in today. So what brings you guys back now?
We just kind of let time get ahead of us, and we didn't realize it's been so long. We've just been busy with work and school and the kids. But what mainly kind of brought us in was Gingy's kind of been complaining that some of her teeth are hurting her.
Okay.
And I also noticed like a few white spots on her teeth as well. And she was also just recently diagnosed with iron deficiency anemia and asthma as well.
Thanks for telling me that, Miss Composites. We're going to take a look at Gingy's teeth, and I'm going to see if I find any of those white spots and any of those other symptoms you were telling me about.
Great.
Okay, so after we were able to take a look, I did notice that there are some of the white spot lesions that you had mentioned, and that is a link to what is called early childhood caries. It's also known as baby bottle syndrome. So the white spots is decay on her teeth, and then some of those blacker areas that we see are those darker spots, that's also decay on her teeth. There's also a direct link between the early childhood caries and the iron deficiency anemia.
Really?
Yeah, so because the teeth are softer, it's much easier for decay and what we call little sugar bugs to get attached to the teeth and weaken them. That's where the cavities come in. And also because she has the asthma, she is probably breathing a lot more through her mouth, and that causes xerostomia, which is also dry mouth, and that can also increase the caries or the cavities in her mouth.
Good to know.
So at bedtime, is Gingy using anything as far as liquids that she's falling asleep with?
Well, my mommy lets me drink apple juice with my Peppa Pig sippy cup. Yeah, mommy.
Well, we've been trying to work on that. I just can't seem to get her to go to sleep without it. It's just a bad habit we've been trying to break.
Okay, that's understandable. A lot of children and moms go through that where they like to have those juice or things at bedtime. So that's good to know. So one of the things that we could possibly do is, instead of maybe having the juice at nighttime, maybe just have water at nighttime, or we could have the juice with the dinner instead of at bedtime. What do we think of that?
What do you think of that?
We'll talk about it later.
We can definitely try that.
Okay.
That sounds like a good alternative.
Okay, because that can help, so that way you won't have as much decay on your teeth, and if we can get rid of some of those white spots on your teeth, if we lower the little bit of sugar that you get, okay?
Okay.
So all of that is great information. How many times a day are we brushing, and are we still supervising Gingy when she brushes? And then if we are we using any kind of fluoride containing toothpaste when we brush?
Well, I brush with my brother in the morning, and then at night my mommy's not there, so I do it by myself.
Yeah, she is kind of brushing by herself at night, but we do use fluoride toothpaste.
Okay, that's good to know. So in the daytime, I understand that the brother is helping her, but I think it might be more effective if you actually supervise maybe her and the brother, just to make sure they're both getting a good brush.
Yeah, my brother is 7.
Okay, good. So that's a great age. He probably is a big help. So at nighttime, I'm gonna have mom make sure she supervises you, because you want to make sure you get a really good brush at nighttime, so that way when you're going to change from the apple juice to the water, you'll have more fluoride on your teeth, and when you go to bed, it'll stay on your teeth a lot longer.
So I can drink my apple juice and have fluoride.
So you have your apple juice at dinner, but
Yes,
not at
dinner.
bedtime.
We're gonna work on having it at night, okay? But I can definitely try to supervise her at night with brushing.
Okay, good. So since you're going to be supervising her while she's brushing now, I want to make sure I show you the technique that we want you to use. This is called the Fawn's technique. So you're going to have your toothbrush pretty much about a 90-degree angle at the gum line, and you're going to brush in circular motions from the gum line of the upper teeth down to the gum line of the lower teeth, covering about 2 to 3 teeth at a time, just like that. And then for the toothpaste, we're just going to use about a rice size amount, just a little bit more than a smear. Your toothpaste will probably say that you need a pea-size amount, but because she's a smaller child and has a smaller mouth, we want to make sure that she isn't swallowing any of it.
Okay.
So with that, we're going to just put our smear on there, and then we go to the gum line of the upper teeth and then down to the gum line of the lower teeth, going all the way across the mouth. And then when we open our teeth, open our mouth, we're going to start on the inside, also do circles here, and then sweep up to where we bite our food and chew at right there. Okay, and then we're going to do this for, I will say, about the length of the ABC song, maybe 2 times, so at least 2 minutes.
Okay.
But if she has another song that she prefers to listen to during that time,
Peppa Pig.
okay, so we'll do a Peppa Pig song, and we'll make sure that we do it for the whole song and do all the surfaces, okay? So the outer surfaces, the biting surfaces, and then the inner surfaces. Is that all right?
Yeah.
Good. All right, so it seems like we got good information today. I was able to educate you on how to brush and with the expectations that we want for you guys moving forward. So I'm gonna set up an appointment for you guys to come back in 3 months,
Okay.
just so we can see if there's any difference in the things that we're changing at home with not having the apple juice at bedtime and with changing the way that we brush our teeth. If everything is okay after 3 months, then we can move you back to 6 months, and then we'll see you every 6 months after that. How's
Okay.
that sound?
Sound good?
Mm-hmm.
Perfect.
All right, I'll walk you guys out.
Thank you so much.
Oh wait, let me get your bib. Sorry about that.
Yeah.
Thank you. All right.